Well, Dr. Rubenstein, let me ask you a question about a topic which is interesting to most of us patients, and that is missing teeth. On one hand, when we have a missing tooth as patients, especially in the back, I'm talking about, um, we don't see the immediate need to necessarily always replace them, and yet in the front that would be different because a missing tooth in front looks very ugly, and if my spouses say, hey, go to the other room, but in the back not so much. And at the same token, dentists keep telling us you got to replace those missing teeth, otherwise all havoc breaks loose. I want you to please, if possible, shed some light on what is that all havoc means, and how important really is it. I want your viewpoint, because some of us patients sometimes think that the dentists are only here to, so to say, you need to have that tooth in it because, well, it's money. Almost like you need to whatever in the car fixed when you really don't need it fixed. Tell us your viewpoint about missing teeth and replacing them.
Well, it's sort of an interesting topic you bring up. One of the positions which I've always held in my practice is that um, we should discuss the needs that you want to accomplish. I may point out situations such as missing teeth, and I probably want to find out how long you've been missing these teeth for, how you're doing without these teeth, whether it bothers you. And the question is whether you're bringing it up because you want to know about replacement. Are there concerns? Certainly, do teeth drift? Do they come down? Do they move forward? What happens if I don't replace them? If I do replace them, how to replace them? I mean, you could sell a lot of dentistry by constantly replacing situations like that. But some people who I see have not had teeth in the backs of their mouths for, 10 years, 20 years, 5 years, and yet they're eating, they're perfectly happy. And I'm not sure that if they have any damage that they necessarily need anything. So I think it's something to be discussed. And sometimes, you go ahead and you just do something to think that you're helping them out, and you wind up behind the eight ball. So I think it's something that should be discussed with the patient, but not necessarily put on them. So
I see. So it's a little bit kind of like, maybe it's not a good example, but like we always keep saying more or less any car which drives gets you somewhere. So I can have a nice little not so young Toyota, and it will get me there. It's beautifully working versus a good Mercedes. So now it becomes a little bit. Am I personally really liking that Mercedes so much or want it? Because in terms of functionality, not too big of a difference of getting where you want to go. So you say that does play a lots of role with missing teeth, and sometimes it's oversold. That's what you're telling me.
yes, well, I think that essentially that's really the question.
Mm-hmm.
It's in the back of your mouth, let alone the front. But the
Right.
question is, if you function fine and you don't find that the appearance is bothering you, then the question is, all I can tell you is what, possibilities there are to replace these teeth if you should so desire. But if you are perfectly happy, and you're living without them, and there's not going to be what I think are problems in the future from this, or things that we can watch, then I don't think you should necessarily have something just done unless you want to do it.
Beautiful. That's really good news, I think, to lots of people. Now, tell us, however, now a couple of reasons which could happen where the teeth gets very crooked, they start shifting, they start doing things, and never mind the shifting, because again, it might not be seen. What do I care whether a tooth is crooked in the back to a certain degree? And if it comes down to chewing, I'm telling you, when my wife and me sit down, she barely has finished the salad, and I'm finished with steak and everything, and I start walking away, and she says, honey, we're still eating, and I go, okay, and I sit down again, meaning I don't chew. It wouldn't matter how many teeth I have in it. So anyway, the point is, tell us some really basic problem which could potentially happen because those teeth are crooked. Could the bite go out of alignment? Meaning, could your Like I'm an engineer from profession, and hinges and cogwheels, they need to align, and if they don't align, yes, stuff can go quite wrong. The machine can come to a grinding halt. Is there something like that? If that happens, tell me about it.
Well, the answer is yes, but we don't know. I mean, depends on when I'm seeing you. If it's already happened, and then you have the spacing, which is cockeyed, then the question is, well, does it bother you? And if so, how are we going to realign this? I mean, you could straighten teeth orthodontically to create better spaces and move the teeth. Sometimes you can place an implant. Sometimes you can do a bridge. Sometimes you can't do anything because the situation is too horrible. If you don't have, one of the biggest problems is if you have teeth on one arch, the top or the bottom, and you don't have it on the other arch. Supposing you had upper teeth and back molars on the upper right, and on the bottom right, you're missing all the molars. Over time, the potential for your upper teeth to drift down and actually take the bone with them, because they're looking for something to chew, is a possibility. And when that happens, you can suddenly find that you're basically going to have your upper teeth chewing on your bottom gum, and you may not have room to put teeth in if you should so desire it. So if you're missing, say, lower right teeth, but you have upper right teeth, and the molars may possibly, over time, drift down, they'll close down the chewing space you have. There's less availability to put teeth on the bottom, perhaps to hold the upper teeth in place. Or you may have the upper teeth grow down so far that they're actually chewing you, and it becomes a big problem if you should suddenly desire to put teeth back there. Sometimes you need orthodontics to intrude, sometimes you have to do it surgically, and so this is a problem that you have to discuss, but it's one of the things that if you don't want to do anything and you're okay, as long as you're coming back and I can watch it, we can, tell you if there's a problem. I mean, that's the regularity of care.
So there are sometimes reasons why maybe a missing tooth could down the road create havoc, but we don't really know that, and we can watch and see, and as long as people keep coming regularly to you, they don't have to necessarily do it today in order to make it to prevent those problems. It's a problem which slowly creates, and if the person does come for his regular dental visits anyway, keeps watching it, he will usually catch it and say, look, this is really going in that direction, let's go and do something, and by doing so, again, avoid the real big problem. Correct?
Well, I think that's really the key of it. I mean, in other words, if you present with certain conditions in your mouth and you come back on some regular basis, and we've discussed this, we can at least watch and see what happens, whether it's recession around the gum, extrusion of a tooth, no extrusion, but the possibility of it, spaces that could open or close, even very slight decay that shows up on an x-ray. I mean, it may not go anywhere. So the question is, if it doesn't go anywhere, do you really need a filling? Probably not. So if you, are sort of regular about your dental care, and you know what the problems are that are there but may not be causing you a problem, then you can either treat or not treat, and if a situation we think has to be really closely watched, you may have to come back and look at it. But, if you disappear for 3 years and things change, that's that.
Now you might have crossed that bridge, you might have fallen off the bridge, and at that point, the problem is large and etc. I got it. Wonderful. Very refreshing to kind of like, to talk to a doctor who isn't instilling the fear of God into people about this whole thing, and says, look, keep watching it regularly. When we know that there's a potential because they're teeth missing, let's watch it. And if we keep watching it in those 4 to 6 months where you're supposed to come back anyway, we will always catch it. We will see that it's sliding in the wrong direction, and we'll be able to do something when it is really needed. But why do it when it isn't needed? Correct?
That's correct. I also would also say that one of the problems in healthcare is essentially that if you have dental insurance and the dental provider is becoming the question of becoming the care provider, that they sort of say, well, we're only going to pay for this, we're not going to pay for that, or, my dental insurance doesn't cover that. Well, I think you have to make your own decisions based on your health and your desires. So, I mean, you just can't always think that you're going to get the best care if you're letting some insurance company, manage your health care. So
right. Well, obviously, well, especially like some people who have the HMO, which stands for Health Maintenance Organization. The word maintenance is the key word here. They don't try to get you better. They just try to hopefully not to get you worse by maintaining it. And that's people need to obviously realize that only because the insurance doesn't want to pay for it doesn't mean you don't need it. I think that's a very valid point, obviously. But at the same token, the doctor, as I said, it is great because many times people are very afraid because they get told that anytime you have a missing tooth, it must be replaced now. And quite often that's expensive. And in an economy like today, it scares people. So even if they don't do it because they don't have the money, now they go to bed worrying about something big happening. But if they talk to you, they might realize that, hey, cool it. Yes, maybe we need to do something, but at this moment, actually, it's not all that bad. Thank you very much, Dr. Rubenstein.
You're welcome.